The listening part of the occupational English test has 3 parts, and in each part you will hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You will have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a healthcare professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a physician talking to a new patient called Mrs. Delilah. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning. What's your problem?
Well, I have persistent mild weakness in the left leg and occasional off and on numbness in the left hand. I have shortness of breath often.
Do you feel any weakness in your arm?
No, doctor, but I am ambulating with a cane.
Was there any history of falling down?
No, doctor. I had repeat carotid Dopplers and further imaging studies shows no further increased stenosis in my left internal carotid artery.
Okay. What is your age?
51, doctor.
You had any illness and treatments?
Yes, I had cerebrovascular accident but got treated.
What medications are you taking?
Plavix, aspirin, levothyroxine, lisinopril, hydrochlorothiazide, Lasix, insulin, and simvastatin.
Any allergies due to medications?
No, doctor.
Is there any history of illness of your family members?
No, doctor.
Well, your blood pressure is 170/66, heart rate 66, respiratory rate 16, your weight is 254 pounds, and your temperature is 98. Normal cephalic and atraumatic, no dry mouth, no palpable cervical lymph nodes. Your conjunctiva and sclera were clear. Your cranial nerves show mild decrease in the left nasolabial fold. There is a mild increased tone in the left upper extremity. Deltoid shows 5/5. The rest shows full strength. Hip flexion is 5/5 on the left. The rest shows full strength. Reflexes were hypoactive and symmetrical. Your gait is mildly abnormal. No ataxia noted. Wide-based, ambulated with a cane. Status, post-cerebrovascular accident involving the right upper pons extending into the right cerebral pedicle, with a mild left hemiparenthesis. Status, post-cerebrovascular accident involving the right upper pons extending into the right cerebral peduncle, with a mild left hemiparesis, has been clinically stable with mild improvement. For now, continue using antiplatelet therapy and statin therapy to reduce the risk of future strokes. Continue to follow with endocrinology for diabetes and thyroid problems. You must strictly control your blood sugar level, optimizing cholesterol and blood pressure control, regular exercise, and healthy diet. I am planning for surgical intervention for the internal carotid artery. Extract 2. Questions 13 to 24. You hear a physician talking to a patient. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. Please be seated. What's your problem?
Well, I have been facing this problem with respect to tonsils for many years. I have throat pain.
Do you feel any difficulty in swallowing?
No, doctor, but I have got this habit of snoring loudly.
Do you get sleep apnea episodes?
No, doctor. Often, I am a mouth breather, especially at night times, doctor.
What's your age?
17. I had 3 bouts of tonsillitis this year. On an average, I get about 4 bouts of tonsillitis per year.
Okay. Have you had any illness, treatments, or surgeries earlier?
Yes, I had a cholecystectomy.
What medicines are you taking now?
Nothing, doctor.
Is there any family history of illness?
Well, my sister has ear infection. Rest of my family members have history of cancer, diabetes, heart disease, and hypertension.
Well, your physical examination results show your pulse is 80 and regular. Temperature is 98.4. Weight is 184 pounds. Your tongue, lip, floor of mouth are noted to be normal. Oropharynx does reveal very large tonsils measuring 3 plus or 4 plus. They were exophytic. Mere examination of the larynx reveals some mild edema of the larynx. You have enlarged tonsils. You have developed chronic angiotonsillitis with angiotonsillar hypertrophy, upper respiratory tract infection with mild acute laryngitis. You have obesity issue. I would recommend that you go for andinotonsillectomy. The risk may include bleeding, infection, scarring, regrowth of the angiotonsillar tissue. There may be need for further surgery, persistent sore throat, voice changes, etc. This is the end of Part A.